Hi, this video is for the ladies on the raw detoxification lifestyle, as well as those who do various types of fasting. One of the things that I want to address today is why so many women lose their periods when they change their diet. Now, I myself personally do not miss having a period, but many women find it alarming and they think that this could be a sign of bigger problems. And in some cases, it certainly could be. So I would like to sort this issue out for you and hopefully help you to figure out if you do indeed have something to be concerned about. As women, periods are something that we have come to accept as a part of our normal existence, even though they are inconvenient and they disrupt our daily routine. Aside from the messiness that requires additional adjustments to our self-care and hygiene, many women also suffer painful periods that are defined by cramping, bloating, and mood swings, not to mention the possible loss of iron as a result of hemorrhaging for days, which can be especially concerning for those who suffer from anemia. Now, this kind of discomfort used to be my reality. It used to be my normal. Twice a month, I would get intense migraines that would coincide with my cycle. And these migraines would be accompanied by a constant, sharp stabbing pain in one of my ovaries and my lower back. And this pain would stay with me for days. Not only did I have to take painkillers, but I would also have to be attached to a heating pad for nearly a week just to get through it. And to add insult to injury, I would also have to contend with water retention, pimples, inability to control my emotions, and a voracious, insatiable appetite where I would want to eat everything in sight. I know many women who are debilitated by their periods to the point of having to take time off from work. They actually have to withdraw from normal activities and put their lives on hold until their cycle passes. And these are not extreme or rare cases. The statistics provided by the Mayo Clinic show that as many as 3 out of 4 women experience some form of distress, be it physical or emotional, related to their monthly cycle. Now, 3 out of 4 is a lot. Growing up, our well-meaning moms and school nurses had told us that it's all just a normal part of womanhood and that women should just simply accept it as our cross to bear for the privilege for being able to have children. Now, if you ask me, it's kind of a bum deal, especially if you consider the additional hardships of pregnancy, childbirth, and the postpartum depression that often follows. All of them taking a tremendous toll not only on the body, but our psychological state as well. What I would like to do here is challenge this idea that our symptoms relating to the monthly cycle are normal, or that bleeding is even necessary at all. The problem is that culturally, we tend to normalize things that are common. We say, well, since this happens to 3 out of 4 women, then they must be the norm. And it's the ones who don't get these symptoms that are the aberration and the outliers. But just because something is common, it doesn't mean that it's right or it's correct or healthy. The prevailing medical wisdom is that if a woman misses her period, then something is wrong. What we know is that once every month, an egg is released during ovulation, which of course is an opportunity for procreation. If the egg gets fertilized, then an embryo is created, resulting in pregnancy. However, if the egg does not get fertilized, then the body expels it along with the uterine lining that was meant to receive and nurture this newly formed embryo. When we discard the egg in the uterine lining is what causes the bleeding we call period. And this process gets repeated every single month until we run out of eggs and hit menopause. But if you listen to true naturopaths who are vitalists, meaning that they advocate for the raw living diet and minimal toxic exposure, they will tell you that menstruation is a cleansing mechanism and that the consequent bleeding is simply a side effect of this process. This means that if the body is clean, then there's nothing to cleanse, and therefore no bleeding is going to occur. Dr. Morse consistently says that fully raw women who have detoxed their bodies either bleed very little or don't get their periods at all. So let's look into this. I have many clients who are concerned because they have lost their period after going raw or undertaking a prolonged juice fast or water fast or maybe dry fast. Now, we've been led to believe that bleeding is natural and necessary, but from what I am seeing from my personal experience, this may not be the case whatsoever. Think about why we bleed in general. When we cut ourselves, the blood comes in to cleanse and oxygenate the area that is either damaged or stagnant. And you see this also when you pop a pimple or squeeze out a blackhead. The blood rushes in after you drain the abscess because the body goes into the cleanup/healing mode. You will always see more blood in cases of infected pimples where there is pus, which you may have seen in pimple popping videos. And sometimes it can actually be shocking how much blood keeps gushing after the pus has been squeezed out. What this tells us is that the more inflamed and compromised the state of the affected area, the more blood the body will bring in to restore balance and stimulate healing. Now, to put this into proper perspective, I want to remind you that we have two major fluids servicing all of our cells. It's lymph and blood. Lymph is a part of the sewer system that cleans and removes waste from the interstitial spaces that surround our cells. The blood, on the other hand, is the kitchen of the body. In terms of chemical composition, lymph is actually just like the blood plasma, but without the red corpuscles. So when you have an area that is stagnant and toxic and acidic, because the lymphatic system doesn't move well or doesn't drain, and the waste starts to accumulate, suffocating the cells, the body will try to keep it alive by bringing oxygen and nutrition through the blood. With a pH of 7.4, our blood is alkaline and is therefore used to alkalize acidic areas. So the more acidic you are, the more blood you're going to see in a damaged area. But if your lymph is moving well and you're not acidic and there's no impediment to the flow of energy and fluids, then there's really no need for blood flushing. You may have heard about the arcane practice of bloodletting that originated in the ancient Egypt, which used to be a part of standard medical treatment to cure all manner of illness for nearly 2,000 years. And it only tapered off in the late 19th century. Even today, many doctors will concede that it wasn't entirely useless because it did have regenerative effects via the cleansing and oxygenation. It would also help to lower the blood pressure by reducing blood volume. It also encouraged the body to refurbish the blood and improve its quality and composition by helping to manage the red blood cell count. Phlebotomy is still being used today in modern medicine to manage polycythemia, which is a cancer where the bone marrow produces too many red blood cells. Another form of bloodletting that's still being practiced today is through the use of leeches, especially in post-surgical care when trying to restore blood flow to damaged tissues in order to ensure that they don't die. You may have seen this on the program called Botched, which is a reality show about fixing plastic surgery mistakes. Bloodletting also stimulates stem cell formation in the bone marrow. You see, when we lose blood, like after a donation, in order to replace the lost red cells, the special peritubular cells in the kidneys sense the decreased oxygen levels in the blood, and they start secreting a protein called erythropoietin. When this protein reaches the bone marrow, it signals to the stem cells to produce more red cells. So as you can see, bleeding has an alkalizing and healing effect in the body. Oxygen carried by blood is essential for healing because its concentration is in perfect ratio and proportion that's necessary for the regeneration of tissues. Having too much or too little oxygen will cause the wound to not heal correctly. The platelets create clots that also contain fibrin, which is a protein that creates a protective net. Fibrin is the first responder when the body is injured. The name itself implies that it has fabric-like qualities, almost like a bandage that the body creates to seal the damaged area. Then the white blood cells, known as macrophages, fight infection and facilitate the repair process by producing growth factors. These are chemical messengers that patch up the wound. On the other hand, the red blood cells help build new tissue by stimulating the cells to produce collagen. Another interesting thing that was recently discovered is that electric stimulation speeds up wound healing by helping blood vessels carry white blood cells and oxygen to the affected tissues. Not only that, but it accelerates the growth of the new blood vessels that replace the ones that have been damaged. Now, what does this have to do with the loss of period on a raw diet? Well, if you're familiar with Carillion photography, then you may have seen the images that show the difference in energy that's emitted by fruits and vegetables when they are raw versus when they have been cooked. Alkaline living diet increases the conductivity and therefore vitality of the cells by improving their overall function and healing capacity. Because you see, it's not the calories or vitamins that sustain us. Our cells are powered by electricity. And the highest electrical form of consumed energy comes from raw plants, and more specifically, fruits. So when we are eating a highly electric diet that keeps the cells functioning optimally, then the body is less likely to have the need to resort to emergency measures like blood being diverted to specific tissues. Additionally, if the bleeding does occur due to some structural damage, the electricity that comes into the system from the food plays a role in accelerating the repair process of those blood vessels, thus greatly reducing or minimizing the blood flow. Dr. Morse talked about how he would not bleed after cutting himself when he was on a mono diet of navel oranges for 6 months, and that his wounds would completely heal up in a couple of days. And so it's the same when it comes to the period, which is something that I have been able to verify and confirm through my own personal experience after I have changed my lifestyle and switched to the raw fruitarian diet combined with extended dry fasting. So I went from bleeding 4 to 5 days heavily to light spotting for a maximum of 2 days without any other symptoms. Additionally, when I fast longer than 7 days, I lose my period altogether, and sometimes for many months. But this is starting to happen more often even outside of fasting. And the reason for this is that my body is getting cleaner and becoming more alkaline. So it's operating with less obstructions. This means that if an unfertilized egg detaches and there's no inflammation or toxic matter built up, then there's no need to flush the system or the area with blood. Sorry about the noise, but it's starting to rain, so you may be hearing this on the video. The standard response from conventional doctors is that if a woman loses her period due to fasting or a raw diet, that she must be malnourished or deficient in vital nutrients, or that the body fat is too low to sustain adequate levels of sex hormones. But this is not at all what I see happening here. What's interesting is that my clients tell me that they do in fact ovulate, they just don't bleed. And by the way, it's quite easy to check if you ovulate by using the ovulation tracking tests that can be purchased at any drugstore. Outside of testing, there are some other telltale signs that can indicate when an ovulation is taking place that you may be able to observe. These can be the change in the cervical mucus, where it becomes thicker, or an increase in your body temperature. Or you can notice a softening of the cervix. You may also have some light spotting, or your libido may increase due to the rise in testosterone. And many women can actually feel a little twinge of pain when the egg is released from the ovarian follicle. If you're ovulating and not bleeding, then there's no reason to be concerned, because what it means is that the body continues to operate properly by releasing one egg every month. As already mentioned, this is something that's been happening to me, especially when fasting. Now, it would be one thing if this was happening because the egg was never released, or because due to the extreme loss of fat, I wasn't able to make enough of the necessary hormones to stimulate ovulation. But in my specific case, it so worked out that I started my 7, 9-day, 11, and 12-day dry fasts more than a week after the egg has dropped and the ovulation occurred, which means that I should get my period, right? But yet it wouldn't come. So what gives? Aside from the factors that I already discussed, fasting, and especially dry fasting, adds another dimension to this phenomenon due to its cleansing effects on the body via the process called autophagy. And most women I work with practice intermittent dry fasting on a daily basis, anywhere from 16 to 22 hours. Autophagy, as you may know, is a built-in internal mechanism whereby the body cannibalizes its own cells for energy and nutrition by scouring out and selectively choosing inferior or superfluous cells and uses them as food. Now, the unfertilized egg would be an example of a superfluous cell that is rich with usable material. And so the body says, you know what, we're not going to waste this resource. Instead, we're going to use it for fuel. And whatever remaining parts are salvageable are then recycled and utilized for rebuilding other tissues and structures. I don't know if you know this, but as many as 10 eggs mature during each cycle. Yet only one is released into the uterus, and the rest are reabsorbed into the body. So it's not at all unusual for the body to use the eggs outside of fertility. Now, this would be the scenario wherein the loss of period happens because the body is working better and more efficiently due to superior diet and deep cleansing that has taken place. But what if your amenorrhea is because you don't ovulate? If you were able to confirm that you have no ovulation, then the culprit is most often the pituitary gland or ovarian failure. Of course, in the glandular hierarchy, the pituitary is governed by the hypothalamus, which directs the pituitary to then signal to the ovaries to release eggs. This means that if the pituitary is sluggish, or if it's not getting proper signaling from the hypothalamus, then it cannot adequately send orders to the ovaries by producing the follicle-stimulating hormone. When these follicles containing eggs start to grow but do not receive the correct signals, the growth process is interrupted, and the immature eggs then remain in the form of cystic sacs. What can also happen is that both the pituitary and hypothalamus may be working just fine. But if the ovaries themselves are damaged or are being suffocated by stagnant lymph, then they simply cannot do the job despite receiving the signal that's being sent by the pituitary. You may also have irregular periods when one of the ovaries is compromised while the other one is still working properly. Because as you may know, only one of your ovaries ovulates during any given cycle. So if, let's say, your right ovary shows signs of degeneration when it is its turn to ovulate, you will not get your period, especially if the fallopian tubes are affected as well. But when the functioning left ovary takes a turn, then the period occurs. Now, if the fallopian tubes are blocked because of heavy lymphatic stagnation or adhesions that happen as a result of inflammation that causes scar tissue to build up, the egg cannot travel to the uterus for implantation. Hence, the ovulation doesn't occur, and neither does a period. One of the best non-invasive ways to assess the condition of your HPA axis and ovaries is through iridology, where we can see the state of all the glands and are able to tell whether or not they're genetically weak, whether they're lymphatically suppressed, or if they show any tissue damage. And it's important to take other glands into consideration as well, because thyroid and adrenal disorders are also implicated in the lack of menstruation. For example, thyroid hormone T3 regulates ovulation and the production of other hormones. Hypothyroidism is associated with a range of menstrual irregularities, from heavy, frequent menstrual bleeding to infrequent or even absent menstrual cycles. How this happens is that an increase in thyroid-releasing hormone can trigger the release of prolactin by the pituitary gland. And prolactin happens to interfere with the production of estrogen in the ovaries, thus causing infrequent or absent periods, as well as other potential symptoms like infertility, abnormal milky discharge from the breast, and symptoms of menopause, such as hot flashes and vaginal dryness. But what's tricky is that both hyper and hypothyroid conditions are implicated in absent or irregular cycles. In hyperthyroidism, an increased production in the thyroid hormone indirectly causes an increase in sex hormone binding globulin, which can prevent ovulation. Additionally, excessive production of thyroid hormone during pregnancy can increase the risk of miscarriage. So thyroid function should definitely be looked at when dealing with absent menstruation. When it comes to adrenal glands, and specifically increased cortisol production that results from chronic stress, you will have depletion of sex hormones because most of cholesterol is being used up for production of cortisol in order to deal with the stress, thus creating a deficit when it comes to making adequate levels of estrogen. High cortisol also suppresses the pituitary's ability to release luteinizing hormone, which is necessary for ovulation. Therefore, high cortisol suppresses ovulation and creates an imbalance in the ratio of the sex hormones, affecting fertility. Not only that, but increased cortisol also leads to insulin resistance, which is implicated in PCOS, which is the polycystic ovarian syndrome, that of course is implicated in absent menses. So the other aspect of adrenal dysfunction and its impact on fertility is impaired sugar metabolism and faulty signaling to the pancreas that results in insulin resistance. When insulin levels remain chronically elevated, the body becomes resistant to it, which means that the body is not able to burn fat as a source of energy. And this affects hormonal signaling to the ovaries. What's tricky is that both hypo and hyperthyroidism can exacerbate insulin resistance because thyroid hormone T3 affects the cell's sensitivity to insulin. But this is a two-way street because on the flip side, insulin resistance affects the body's ability to produce adequate levels of T3, which means that insulin and T3 impact each other. The good news is that if your problem is insulin resistance, there is nothing better than fasting to promote and increase insulin sensitivity. So as you can see, there is a complex interrelationship between the various glands that can have an impact on ovulation and fertility. So if you stop having your periods and do not ovulate, you're going to have to look into your hypothalamus, pituitary, thyroid, adrenals, and the ovaries. liver and gallbladder function also impact our neuroendocrine system and can suppress the HPA axis. But that's a much longer and more complex discussion. Let's talk about how the diet affects our glands and subsequently our periods. What happens when we go raw and remove all stimulants from our diet is that we come face to face with the true state of our glands and their level of dysfunction, which may translate into a number of problems that can be experienced when we initially begin detoxing through the raw diet and fasting. Detoxification and acid removal from the glands in of itself can cause changes and fluctuations in glandular function. You see, when a weak gland is being overstimulated by acute lymph, it may create the illusion that it's working, which is often the case with the adrenals and the thyroid. But as the acids back off, the gland may become sluggish and underactive. So herbs and, in some cases, glandulars may be needed to support these glands and tissues. Otherwise, you may find your detox journey to be a steep uphill climb, where you may find yourself struggling with simple, normal, everyday tasks and activities. I do want to caution you with respect to glandulars, though, because what I find is that in many cases, people take them incorrectly or unnecessarily, which in of itself can create a whole different set of problems. Personally, I never recommend glandulars without looking at the person's eyes and doing a proper assessment of the entire glandular system. If you cannot read your own eyes, then I recommend that you enlist the help of a detox coach who also specializes in iridology, so that they can devise the most effective and appropriate protocol for your specific case. When I do iridology analysis, my clients get a personalized handbook that is sometimes over 100 pages long that gives them a very detailed look into the state of their lymphatic system, their genetic weaknesses, and even their personality. Not only that, but they also get tons of information about how their system is supposed to work and where their specific symptoms come from, as well as what they mean and how to make them better. But regardless of whether or not the client chooses the written iridology report, I always require eye photos because looking at symptoms alone isn't always enough to figure out the true cause of the problem, especially when it comes to our glands. So I definitely recommend enlisting the help of a qualified natural health coach to help you navigate through some of these issues. And remember, it's quite normal to experience hormonal fluctuations throughout detox, while the body keeps adjusting as it moves through the various stages of lymphatic stagnation and release of acids. So stick with it because it does get better, I promise you. Thank you for watching, listening, and sharing. And if you found this information useful and helpful, please like, share, and subscribe.